Now, according to the Constitution, health is a human right. But residents of Titila in Tana North, health services there are a rare privilege. A nurse has given her time to visit that remote area every Sunday and give first aid and medical attention with the slimmest of resources. Our senior Coast reporter Ferdinand Omondi visited that remote village and brings us the story of a place where patients can only get to see a medic once a week.
Titila Market, Bura. It's a market day and business is flourishing, especially livestock trade. Hundreds have gathered to exchange goods and services in this center, located in the remote, arid area of Tana North, 388 kilometers north of Mombasa. In one corner of the market, Grace Mwikali is also preparing her stall to provide a unique and very essential service. Mwikali is a trained midwife, but here she is a doctor, nurse, midwife and lab technician rolled into one. She is the only available medic around within a radius of 60 kilometers. On this day, one of our early patients is a baby with multiple wounds, one of which is festering. Mwikali carefully attends to the baby, one wound at a time, cleaning, disinfecting, applying medicine, and then finishes off with an injection. At a corner of the shade, another patient has been temporarily admitted and put on drip. He has been diagnosed with diarrhea.
Alikuwa anahara, anatapika na kichwa inauma. Ukimwangalia hivi, unaona hiyo kuwara na kutafika, anaweza ishiwa na maji.
Mwikali has no lab equipment to help with her diagnosis. She admits depending purely on the patient's descriptions has its challenges. It is a makeshift medical center with the most basic of material: syringes, needles, cotton wool, drugs. The nearest medical center is in Bura, over 60 kilometers away. The other one on the other side is Bengala, about 65 kilometers away. Area Administrator Ishmael Bonai reveals that the prohibitive distance has made life unbearable for patients, especially women and children.
Kwanza watu wa hapa huwa hawapatangi chanjo mara kwa mara. Especially watoto wadogo chini ya mwaka 5, tunasikianga kwa radio kwamba watoto wanapatanga chanjo, na kina mama wajawazito pia huwa hapate ile kliniki ya kawaida kwa sababu watu hapa hawako karibu na zahanati ya afya.
It gets worse when there is an emergency. Titila has no network coverage and locals have to ride motorbikes at least 15 kilometers away to first find network and then call for help. Mwikali says she has handled several deliveries but has watched desperately as some situations which require advanced equipment become fatal.
Tuseme kwa mfano, mtu amejifungua na ile placenta ikose kutoka, au wanakufanga saidi, si moja ama wawili. Sababu unajua wanatumia ile njia ya kupatia homo, wanawapatia homo. Sasa ukipatia mtu homo na placenta iko ndani, anaweza kufa haraka.
Mwikali comes here only once a week during market day when human traffic is high. Her disposal box is evidence of just how busy she can get, and they are grateful she brings medication closer. Mwikali, on her part, believes she could do more if she had much needed support.
Zaitwe sana sana na mashini ya kupima na mtu wa lambu. Sasa huyu mtu wa lambu atakuwa anawapima, ananiletea kipimo.
However, the consensus in Titila is that the population would be much better off if the county or central government could bring medical services much closer to prevent unnecessary loss of life. When she is done for the day, Mwikali will retreat to her base in Bangale until 7 days later when she returns. It may not be the most conducive environment for medical services, but this is all they have. Without this service, they may have to travel at least 60 kilometers for the most basic of medical services, and the locals are grateful that they don't have to do that at least once a week. Ferdinand Omondi, KTN, Titila, Bura.